어디 때문에 왔노?
턱
턱이? 이해봐. 턱이 삐뚤어져 있구나. 벌레도 닫아도 해봐. 해볼래? 오로지 이 안면비대칭 때문에 온 겁니까? 이게 생각에는 오늘 요만큼의 변화가 왔는데 10점 만점이라면 몇 점 줄래?
10분.
10점 줄래? 어제는 편하다가 오늘 가서 뭐 불편해진 거 없냐고.
물건이 조금 아파서.
골반이 아팠어? 어제보다 등이 좀 펴져 안 펴져? 펴져? 너도 노력을 좀 더 할수록 더 빨리 펴진다. 응? 머리가 아프거나 어깨가 아프거나 뒷목 다른 이상 없었어. 어떤 거 비교해봐.
좋아진 것 같아.
좋아졌어? 어떤 면이?
그리고 허리도 좀 펴지고 시원해지고.
너 옛날에 이런 힘 꿈도 못 꿨잖아. 처음 할 때는 하나도 없었지. 오늘 몇 번째 치료?
3번.
세 번째 치료? 세 번 치료받고 만족도 몇 점? 벌레 따뜻 해봐. 오, 많이 가운데로 오네? 어? 많이 오네. 안면이 비대칭인 게 점 만점이라면 얼만큼은 좋아진 것 같아? 9점? 많이 그럼 마음에 드네? 응? 미드라인으로 와 있는 거는 굉장히 어딘가 모르게 어색할 거 아니야. 어색하지? 그죠? 원래는 그게 정상에서 편해야 되는데 그동안 틀어진 상태에서 모든 게 네 턱 관련 근육이 다 그치기 배열돼서 이렇게 되는 거란 말이야. 그러면서 이빨이 교환면이 거기에 다 편안하게 배열이 되어 있는데 전혀 다른 위치의 교합이 움직여지니까 어색하고 불편할 수밖에 없어. 처음에 아빠가 보고도 그냥 가만히 평소에 있을 때 얼굴이 조금 뭔가 변화 보는 것 같다는 느낌이야.
네, 좀 이제 한쪽만 펴놓았었는데.
근데 이 변화되는 속도가 사람마다 천양지차라. 그래도 지금 돌아오는 속도가 빠른 축에 해당돼.
좋았어요.
어지럼증, 뭐 등등 비염이나 등등 다 괜찮아? 응? 다 나았어? 손발 저리고 잡고 실을 끌었더니 요즘?
그런 거 없었는데.
괜찮아? 좋아? 좋았어?
좋았어요.
좋았어? 뭐가 좋았어?
그냥 몸도 좋고
또,
소화도 잘 되고
또.
머리도 맑고 아침에 일어났을 때
턱은 어때? 지그재그로 벌어지는 게 아주.
좀 좋아진 것 같아요.
좋아졌어?
네.
아, 또 벌려 해봐. 오, 얼굴은 처음보다 어때?
많이 좋아졌어요.
어떻게 좋아했어?
많이 돌아왔어요.
해봐. 자동으로 가운데로 오는 거야?
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the block channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the atlas C1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as a main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposal custom-made intraoral balancing appliance which allows balance of TMJ at the optimal freeway space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of patients.